Welcome to Kavita Medicos Education. This is part third of diabetes mellitus. So here in part third, we are going to study with the treatment and management for diabetes. And please visit part first and second of this video for easy understanding of part third. And you can check the link in my description box. So let's start with the treatment and management for diabetes. So first management for type 2 diabetes, we have lifestyle management. Okay. So before discussing the lifestyle management, what are the goals of our treatment and management? First goal we have that we have to decrease the blood glucose level, or we have to maintain the normal sugar in the patient. Second goal we have that we have to prevent the acute complication and late complication in the patient. And next, third goal we have to provide the patient a better quality life. So let's start with the lifestyle management. So this lifestyle management is very helpful in type 2 diabetes mellitus. If patient HbA1c or glycated hemoglobin is not less than 7%, then we can suggest the patient to do some lifestyle management. So according to American Diabetic Association, so how much calorie we should take from each food? So 50 to 60% calories should be taken from carbohydrates, 20 to 30% should be from fat, and 10 to 20% of calories should be derived from the protein. So this guideline was given by American Diabetic Association. So next, what you can do? You can take low sugary diet, okay, low refined diets, and you can have low sugar content in your diet, low refined carbs in your diet, and do not eat highly processed food and junk foods. Next, you can add high fibers in your diet, like vegetables and whole grains. For example, we have cereals, we have oats, and we have chapati. Okay, so these are our whole grain cereals. Okay, so add most fibers into your diet because this fiber will help in the metabolism of carbohydrate. Next, suggest the patient and tell the patient to do the exercise. Okay, so 30 minutes of exercise is very helpful in type 2 diabetes. In exercise, patient can do walking, he can do yoga or cycling. Next, we have even 5 to 10% of weight loss is very helpful in type 2 diabetes. Okay, so eat at regular intervals. So always take your food at same time. Okay, do not skip the meals. If you are skipping the meals, then there are chances that patient can go in hypoglycemia condition. Next, we have stress. If you are in stress, then stress always increase the blood sugar into your body. So do the stress management programs, like do the yoga, do the meditation. Next, always take the 7 to 8 hours of sleep. So these are some lifestyle management, and always avoid smoking and alcohol. Okay, so patient can have lifestyle management for decreasing the type 2 diabetes or decreasing the blood sugar, decreasing the blood glucose level. Okay, so lifestyle management play important role in type 2 diabetes mellitus. Next, we have oral anti-diabetic drugs. So what are the medicines that we will provide to the patient in type 2 diabetes? So in type 2 diabetes, second management or second treatment we have that are medicines, that are anti-diabetic medicines. So first medicine we have bugonides. So metformin, for example, we have metformin. Okay, this bugonide is a class of metformin. Okay, so in bugonides class we have drug, we have medicine that is known as metformin. So this metformin is a first prescribed medicine or first choice in type 2 diabetes. So what this metformin will do? This metformin will decrease the glycogenesis process in the liver. Okay, glycogenesis process means when the liver will release the glucose slowly into our blood. So it will decrease the glycogenesis process from the liver. Okay, this metformin will decrease or reduce the glucose production from the liver. And just remember, avoid the metformin in the renal failure patient or kidney failure patient. Why? Because if patient have kidney failure, he have renal failure, then the metformin or lactic acid will get accumulated in the blood and it will lead to a condition that is known as lactic acidosis, which is a medical emergency condition. Next drug we have, that is sulfonoureas. For example, in this we have medicine, for example, glimepiride and glyburide. So what these sulfonoureas drugs will do? They will increase the insulin secretion from the beta cell of pancreas. Okay, they will stimulate the pancreatic beta cell for the production of more and more insulin. And while you are giving sulfonoureas to the patient, just check for hypoglycemia, as hypoglycemia is a very dangerous condition than hyperglycemia. Okay, if patient will have low blood glucose level, so this is more dangerous than hyperglycemia. And avoid the alcohol in the patient, because this alcohol will inhibit the glycogenesis process in the liver, as if when patient will consume the alcohol, then liver will metabolize the alcohol first, okay, and it will forget the release of glucose in the blood, and eventually patient is taking the sulfonoureas drug, which will increase the insulin in the body. Okay, so there are more chances that patient can go in a hypoglycemia. So just check the blood sugar level of the patient, monitor for the blood glucose level of the patient while you are giving sulfonoureas to the patient. Next drug we have glenides. So in glenides we have example like repiglenide, and next we have netiglenides. So they will increase the insulin sensitivity in the peripheral tissue. Okay, they will help our peripheral tissue like the muscles, like our adipose tissues or fat tissue to take the insulin. Okay, so they will increase the insulin sensitivity in our peripheral muscles and in our peripheral tissue, okay, in the adipose tissue. So they will increase the easy uptake of insulin in cell and tissue. Next, they will also stimulate the pancreas to release more insulin, okay, and always give this medicine 15 to 30 minutes before the meals, okay. So it will control the post-prandial or after meal blood sugar level, okay. It will control the spikes of blood sugar level in the patient. It will control the post-prandial blood sugar. So always give this medicine 15 to 30 minutes before any meal. And if patient have taken glenides, then suggest the patient that do not skip the meals. Okay. Next drug we have SGLT2 inhibitors. For example, we have dapagliflozin here. So what this SGLT2 inhibitor drugs will do? They will inhibit the glucose absorption from the renal tubules. Okay. So what our kidney do? Our kidney absorb the extra glucose from the blood. Okay. It will absorb the extra glucose, which will automatically increase the blood sugar in the patient. So this SGLT2 will inhibit, okay, it will stop the process of glucose absorption from the renal tubule or from the proximal tubule. So it is stopping or inhibiting the glucose absorption from the kidney. Now, glucose is not absorbed into the body. Now, where this glucose will go? So this glucose will remove into the urine of patient. And if more and more glucose will come in the patient, then patient can have fungal infection in the genital area. He can also have urinary tract infection, that is UTI. There are more chances that patient can have UTI. Because when more glucose or more sugar will go in urine, then there are chances that bacteria and microorganisms will proliferate there, okay, because these microorganisms love the sugar content. Next drug we have thiazolidinase, okay. For example, we have pioglitazone. So they will also increase the insulin sensitivity in the peripheral tissue, or they will help the cell and tissue for easy intake of insulin. Next we have insulin therapy. So insulin therapy is the only choice for type 1 diabetes mellitus, because we have read in part first of this video that in type 1 diabetes mellitus, the beta cells are completely destroyed here. So if patient is suffering from type 1 diabetes mellitus, then he is completely dependent on insulin therapy for lifelong. Okay, and this insulin therapy is given in type 2 diabetes patient if lifestyle management and oral anti-diabetic drugs is not working properly, or if patient have HbA1c level more than 7%, then we will go for insulin therapy. So there are 4 types of insulin. First, we had rapid acting insulin. As the name is indicating rapid, it means it will work in a rapid way. Okay, its action is in a rapid way. So in rapid acting insulin, we have example Humolo and Novolo. Okay, so what is the onset? 3 things we will read here. First, we will read the onset of the insulin. How fast this insulin is acting into our body. What is the peak level? Okay, what is the highest range of this insulin? At which time it will remain highest into our blood? And next, for how much long time it will remain into our blood? What is the duration of the insulin into our blood? So, name is, we have rapid acting. It means it will act rapidly. So, the onset or the action of this insulin is about 5 to 15 minutes. So, it will act automatically into our body within 5 to 15 minutes. It will remain peak into the blood for in 30 to 120 minutes, and its duration is very short, that is 3 to 5 hours. It is working very quickly, but its duration is very short. It will remain into our bloodstream only for 3 to 5 hours. Okay, so this type of insulin are given before the meals, okay, or while you are taking the meals, because these types of insulin will control the postprandial blood sugar level in the patient. Next insulin, we have short acting insulin. What is the name suggesting? Short. It means it will act slowly. Okay, the action is very slowly. For example, we have in short acting insulin, we have Humulin R and Novolin R. So short acting insulin are also known as regular insulin. Okay, what is the other name for short acting? That is regular insulin. So they will act very slowly. So onset is 30 minutes. Okay, it will start working within 30 minutes, and it will remain peak, or it will remain in highest level in our body in 2 to 4 hours, and duration is 5 to 8 hours. Okay, more than the rapid acting. Next, we have intermediate acting insulin. And just remember one thing, that short acting insulin can be given through the IV route. This is the only insulin which is given through the IV route. Next, we have intermediate acting insulin. At name is indicating intermediate. It means this type of insulin are given twice to the patient. For example, you can give this insulin in the morning and in the evening also. So twicely it is given in the patient. So this insulin is known as intermediate acting insulin or NPH insulin. Okay. For example, we have Humulin N and Novolin N. Okay. So it will act, or it will start slowly into our blood. So onset is 2 to 4 hours. It is taking time for starting. It will remain peak or highest into our blood for 4 to 10 hours, and its duration is very long, that is 10 to 18 hours. Okay. Next, we have long acting insulin. It means it will work into our body for very long time. That is why it is called as long acting insulin. For example, we have Lentus and we have Levemir. Its action is 2 to 4 hours. It will start working in 2 to 4 hours, and it have no peak time. Okay, it will remain in the same level into our blood. Okay, there is no peak for long acting insulin. Okay, it will remain in a stable quantity into our blood, and the duration is 20 to 24 hours. It means this insulin can be administered at one time only. Okay, and just remember, if you are administering the long acting insulin in the patient, then give the insulin at the same time. Okay, and at every time of the day, and the duration and dose should be measured properly before you are giving insulin to the patient. Okay, and administer this insulin at the same time. So only one time patient will take the insulin injection, and he will get relief for about 24 hours. Okay, so these two insulin, intermediate and long acting insulins, are the insulin which remain for the long duration in the blood, and these two are the short type of insulin. And whenever you are giving insulin to the patient, just remember that if you are giving insulin in the abdomen area, then rotate the insulin site, okay, and always pinch the surface of the patient and give the insulin in the 90-degree direction, okay. If patient is very thin or lean, then pinch the area and give the insulin in 45-degree angle, okay, and always rotate the insulin site, okay. So these were some management and treatment for diabetes mellitus. Discuss with the complication of diabetes mellitus. So what are the complications which occur in the diabetes patient? So complications are the harmful and problematic effects which occur in the diabetic patient if there is high blood sugar level for a period of time, okay. Then some types of complication or some types of problems occur in the diabetic patient. If diabetes is not treated at proper time, then patient can suffer from some types of complications. So let's discuss with the complication of diabetes mellitus. So here first we will discuss about the acute complication. So acute means the complication which occurs suddenly, okay. These are the rapid onset complication and they need a immediate medical attention, okay. So these are the emergent medical treatments. They occur suddenly, they occur rapidly. That's why it is known as acute types of complication. So here in acute complication, first we have hypoglycemia. Hypo means low, okay. So there is a low level of glucose in the blood. So if there is less than 70 mg per deciliter of blood, means if there is a low level of glucose which is lower than 70, okay. If patient has less than 70 mg per dl of glucose level, then he will suffer from hypoglycemia. Again, this hypoglycemia is being categorized into three. First we have mild, then we have moderate, and then we have severe. So why patient is suffering from hypoglycemia condition? See, if patient is taking excess insulin dose, okay, mainly in type 1 diabetes mellitus, okay. If patient is taking lot of insulin dose and if he is using oral anti-diabetic drug, for example, sulfonylureas. Next we have if patient is skipping his meals, he is doing a lot of fasting, and if patient is doing a vigorous or heavy exercise, and if he is taking or alcohol empty stomach. So these are the causes for hypoglycemia condition, okay. Skipping a meal, taking a lot of insulin, using antibiotics drugs, and drinking a lot of alcohol in empty stomach. So these are the reason for hypoglycemia. So when the blood glucose level will be below 70 mg per dl, then our body will secrete a hormone that is known as adrenaline or epinephrine. Now this adrenaline or epinephrine will do several effects into our body, such as patient can have early sweating problem, he can have tremors in his body, he can have palpitation or low BP, and if this blood glucose level is severely decreased, okay, if this blood glucose level is severely decreased, which is less than 50 mg per dl, then the sufficient amount of glucose will not reach into the brain, okay. And brain is the functional and most important part of our body. Brain needs the glucose continuously. If glucose will not reach to the brain cell, then patient can have severe signs and symptoms of hypoglycemia, such as he can have confusion, okay, patient can go into a coma, he can have seizure, and in severe condition of hypoglycemia, patient may have death, okay. So it's an emergent medical condition. In this case, how you will treat the hypoglycemia patient? Give some oral juices to the patient, or you can provide the glucose to the patient if patient is in a conscious condition. Then provide the orange juices and glucose to the patient. If patient is unconscious, then you can provide the glucose through the IV route, okay. And regularly monitor the blood glucose level of the patient in every 15 minutes. So first we read about the hypoglycemia. Next condition in acute we have diabetic ketoacidosis, okay, that is DKA. So in part first of this video, I have told that in diabetic ketoacidosis, there is a ketone release. into the body of patient, and mostly in diabetic ketoacidosis condition is seen in type 1 diabetes. Okay, in type 1 diabetes we will see the condition that is diabetic ketoacidosis. What happened in this condition? That our body does not have insulin. Okay, there is no release of insulin from the beta cell. Due to the lack of insulin, there is a complete lack of insulin. What will happen? The glucose will not reach into the cell and our cell will feel starved condition. And if this starvation will remain for a long period of time, then our body will start breaking down the fat and proteins. If fat and protein will get break into our body, then they will release the side product that is known as ketone. Okay, whenever there is a fat metabolism or protein metabolism occur into our body, then a side product is released that is known as ketone. Now this ketone is mixed into the blood and our blood will become acidic. Okay, so there is a complete deficiency of insulin. Okay, so what are the signs and symptoms that we will see in the diabetic ketoacidosis patient? Patient will have frequent urination, that is polyuria condition. He will have polydipsia, means excessive thirst will occur, and due to the heavy release of ketones into the blood of patient, he will have vomiting, he will have abdominal pain. Okay, and in some patient a deep breathing is seen, that is known as Kushmal respiration. Okay, so deep breathing is seen due to the ketone formation into his blood, that is known as Kushmal respiration, and a fruity smell or fruity breath will come out of the patient. Okay, so these were some signs and symptoms of diabetic ketoacidosis. It's an acute complication of diabetes, and this diabetic ketoacidosis is a medical emergency condition. Next we have, okay, so there are chances that patient can go into a coma condition and death if this diabetes ketoacidosis is not treated at proper time. Okay, if it remains untreated. Next condition we have, that is known as hyperosmolar hyperglycemic state, that is HHSS. Okay, hyper means there is a high level of there is a thickness in the blood. Osmolarity means the blood glucose level get high. Okay, blood get thick, that is hyperosmolar, means osmolarity of the blood get increased, and there is a hyper condition of glucose, means the glucose, the sugar in the blood get increased. That is why it is known as HHS. Common, it is seen mainly in type 2 diabetes, because in type 2 diabetes some amount of insulin is released into the patient blood. So there is no breakdown of fat and proteins. Okay, there is only increase in the blood glucose and blood sugar level. So so how you will understood this hyperosmolar hyperglycemic state? So there is high blood glucose, means glucose and sugar is more in blood, and there is severe dehydration is seen in the patient. Patient will have a severe dehydration condition, and he will have high plasma osmolarity. It means the glucose is increased into the blood of patient. How much? It is more than 600 mg per dl. Okay, I am writing here. So it is more than 600 mg per dl. So there is a high plasma osmolarity of the blood, and ketones are not released here because some or little amount of insulin is present in the patient body. So a little glucose will go into the cell. So there is no breakdown of fat and protein. So there is no ketone release. And in this condition, patient can go through severe dehydration condition. He can have increased osmolarity, means the blood will get thick. Next we have, if this high glucose will go into the brain, then it can damage the brain cells also, and brain cell gets shrink and he can have confusion and coma in the later stage. So these were some acute complication of diabetes mellitus. Now let's talk about the chronic and late complication. Chronic means the complication which occur after few years. Okay, so these are the complications which occur later in the life or which occur after few years in the life if diabetes remain uncontrolled for long period. So here again in chronic or late complication there are two parts. First we have microvascular. Micro means the small blood vessels of our body. Okay, if there is damage in the small blood vessels of our body, then patient can have microvascular complication. So in microvascular complication, first we have diabetic retinopathy. So retina is a layer which is present behind the eye. Okay, if this high glucose will reach into the small blood vessels of the retina, then they will do a damage in the retina blood vessels, due to which retinal blood vessels get leaky. Okay, and there is a damage or claudication in the retinal blood vessels, due to which in starting phase patient can have blurred vision. Next, he can have cataract or glaucoma condition. If this diabetic retinopathy remain untreated for long period, then patient can have complete blindness. Next condition, we have diabetic nephropathy. So what is nephro? Nephro means nephrons. So nephrons are the smallest unit of kidney. So our kidney is filtering a lot of glucose. Okay, there is a high level of glucose in diabetes. Okay, there is a high level of glucose in the blood, and our kidney is filtering this high level of glucose. So what will happen after a few years, if this kidney is filtering a lot of glucose, then it will get tired, and slowly the glomeruli of our kidney get damaged. The smallest unit, the filtering unit of our kidney get damaged due to high level of glucose, and slowly what will happen, patient will have protein loss from his body. Okay, there is a protein loss in his urine, as glomeruli get damaged due to high pressure of glucose in the kidney. In this way, we can see several symptoms in the patient, like patient can have edema. Edema means there is a swelling in the patient body. He can have hypertension, there is a high BP condition, and patient can have chronic kidney disease or kidney failure. Next condition, we have diabetic neuropathy. Neuro means nerves. So here high sugar is damaging the nerves of the patient. So the nerve of the patient are damaged here, mainly the peripheral nerves. So what are the peripheral nerves? The nerves which goes into the hands and feet of our body, that is known as peripheral nerves. So there is a damage in the peripheral nerves of the patient, due to which patient can have various symptoms, like he can have tingling sensation in his feet and into his legs. He can have numbness. Okay, he can have burning sensation in his feet, and there is a loss of sensation. So if the sensation of nerve get lost, then there are chances of developing the ulcers. So there are chances of ulcers in the patient. Now let's talk about the macrovascular. Macro means if this high blood sugar is damaging the large blood vessels of our body. If this high amount of glucose which is present into our blood is damaging the large blood vessels of our body, that is known as macrovascular complication. So in macrovascular complication, first we have coronary artery disease. Coronary means the arteries or the blood vessels which are supplying the blood to the heart. Those are known as coronary artery. Now this high level of glucose will damage the blood vessels of the heart. Okay, they will damage the inner lining of the coronary artery, that is known as endothelial lining. And due to the damage in the endothelial lining, what will happen? The plaque or the fat will deposit it into the blood vessels. Okay, and slowly patient will go in a CAD condition, that is coronary artery disease condition, and this coronary artery will get stiff. They will lose their flexibility power, due to which they will become very narrow, and heart will not get the proper supply of blood. So patient can have angina, he can have chest pain, and if it remain untreated, then he can have myocardial infarction, that is known as heart attack. Next condition, we have stroke. As diabetes will do a damaging effect into our whole body. Okay, so if this high level of blood glucose will reach into the brain, then it will lead to a condition that is known as stroke. Okay, so patient can have a stroke or brain damage as less blood is reaching into the heart. Means a blood which contains less supply of oxygen and nutrients, it is reaching into the brain of patient, and we all know that our brain need the glucose most. Okay, because brain do a lot of activity in our body. Okay, so brain needs a lot of glucose for its working. So if there is less nutrients oxygen and glucose will reach into the brain, then brain will not do its function properly, and there are chances that patient can go in a stroke condition. Next, we have peripheral arterial disease. Peripheral means our peripheral arteries, which are going into our hands, which are going into our feet. So these are known as peripheral arterial. So what is happening into our peripheral arteries? So there is reduced blood supply to our legs, which will cause a condition that is known as gangrene. So gangrene is a type of condition which occur in the diabetes patient. Okay, so due to the loss of sensation and due to the loss of nerve sensation in the feet especially, patient will have a ulcer or he will have a blister into his legs. That is known as gangrene. Okay, and what is the treatment for gangrene? We can provide the antibiotic drugs to the patient, and at last, if this gangrene remain unmanaged for long period of time, then at the last we can do the amputation. Amputation means removing the whole part of the body. Okay, so at the last we will do the amputation in the gangrene. Next, we have recurrent infection. So as in diabetes, there is a high level of glucose in the body, and we all know that microorganisms loves the glucose. So patient can have recurrent skin infection, he can have dry skin, patient can have itching in his skin. Okay, and in females, what will happen? In females, she can suffer from genital fungus infection, she can have urinary tract infection, that is UTI. Okay. Next, we have at last sexual dysfunction. So this sexual dysfunction is seen both in man and in women who are suffering from diabetes or who have complication of diabetes. So what happens in sexual dysfunction? That both male and female lost their desire of sexual activities, and in females she will have less lubrication from her genital organs, and male will have erectile dysfunction. So these were some complications of diabetes. And if you like my videos, so please do subscribe to my channel, and thank you so much for watching my videos.